I turned 12 in October, and I was perfectly healthy before then, just strep throat and a cold every once in a while. But on December 15th, 2012, I was playing with my dad and I fell, so I put my left hand down to like support the weight, I guess. And after about 2 minutes, my hand started hurting like a lot. And my mom thought like, oh, just put some ice on it, put some ibuprofen, well, normal stuff. But then the next day, we were going to a birthday party, and my mom was like, what happened to your hand? And then I look and it's purple and swollen. And then after that, we went to the ER a couple times to do basic x-rays and nothing. But the pain was getting worse and worse. It was burning and a stabbing pain that I've never felt before. In 2014, yes. We moved here during the summer, but we came prior to moving to house hunt, and I was desperate to go to Clearwater because the beach in Texas is pretty bad. So we went to Clearwater, but I got in by myself, and then all of a sudden my right leg started burning. So I got out of the water, and then I realized that something either bit me or scratched me, and my whole leg was scratched up. And then we did the basic vinegar thing, and we thought, okay, that was it, CRPS, not gonna happen. Or the next day, I wake up and I'm limping everywhere. I got stung by a jellyfish when I was 5, and it was just wrapped around my whole arm, so we didn't know if it would just scratch like that. But then after the same day, we went to my godmother's house. My godmother has those mini ellipticals, but it's just a step. So I was doing that to do PT, and we were about to leave the next day back to Houston, and I put my foot under the pedal, the left foot, and my cousin, I guess, he stepped on the pedal, which then hit my left foot, which left me totally wheelchair bound. I couldn't even use crutches. So I haven't walked since the beginning of July, and then since then, in October, my GI system decided to stop working. So we were also back and forth between the hospitals, and then the IVs were always the problem. And I got a manometry done, and the lady who placed the IV put it on the forearm of my right arm and then spread all the way up. And then afterwards, I was just wheeling around the house, and I pinched my left hand, and then it started flaring up. And my mom was like, okay, that's weird. You're flaring up for no reason. You used to flare up if something major, so to speak, happened. And now you're just flaring up for this, touch. And so then we went to go see other pain doctors, because the first pain doctor we saw wanted to do the neurostimulator, but if we did the neurostimulator, that would only, even if it worked, it would only help the legs and not the upper. So we decided not to do that, and we saw a pain doctor in Newmore's, Orlando, I think. Mm-hmm. And she said her CRPS is still type 1, but it's on stage 3 systematic. So she basically has it all body, and even if she gets bit by a mosquito or anything touches her, then she will flare up. And
we moved here. We needed a new doctor and a new perspective. Unfortunately, when we were before, even though they helped her a lot at the beginning, they did not believe in any other treatment except for physical therapy and just a regular medication. And we knew at this point that she needed more help. It has spread quickly, like Natalia was mentioning. So I researched different options, including HVOT, including children's hospitals, like Natalia was saying, neurostimulators. But then we found Dr. Hanna through a support group They talk how compassionate he was. He's the kind of doctor that never gives up. He has a lot of philosophy that we do believe is caused in CRPS, and as we all know, it's an unknown. But we do believe in his philosophy. We decided to trust and decided to begin with the ketamine treatment. And so far, even though Natalia has proven to be one of the stronger cases, it looks like it's working. This is our 4th week. We're going to start this.
Started on the 26th of January.
Correct. For the first 2 weeks, we saw little improvement. But then slowly we saw her left hand, which was the original onset, with 0 pain, which was absolutely wonderful. And it was...
feels weird.
Exactly. I think Natalia word to describe it was a feel weird because it's been for so long, feeling pain every day for more than years. So for her not feeling any kind of pain, it's
like, this is so weird. It doesn't have the CRPS pain or sensitivity or anything.